In this section we will explain the main principles of your assessment in PACES. PACES is designed to assess your clinical skills in a standardised and consistent manner using a mixture of real and surrogate patients. You are assessed in a total of 8 encounters in 5 stations, each lasting 20 minutes. At each encounter, your performance is observed by 2 examiners who award their marks without conferring. Examiners assess your performance on each of 7 core clinical skills shown on this slide. The 7 clinical skills are physical examination, identifying physical signs, clinical communication, differential diagnosis, clinical judgment, managing patients' concerns, and maintaining patient welfare. Note that a descriptor for each skill that will help you understand what each is comprised of can be found on the website. A varying number and combination of these skills are assessed at each encounter. Note that all 7 skills are assessed at Station 5. The mark sheets also show what skills are assessed at each encounter and will serve as a reminder to you during the examination itself. Examiners will help, but try to manage your time in each encounter in a way that enables you to demonstrate each assessed skill. This is particularly important at Stations 1 and 3, where you must ensure that you present your findings fluently enough to allow discussion of patient management and assessment of your clinical judgment. Examiners mark you on each skill assessed using a 3-point scale. They can award a satisfactory judgment worth 2 marks, a borderline judgment worth 1 mark, or an unsatisfactory judgment worth no marks for each skill assessed. Before the examination, during the calibration or standard setting process, examiners agree just what a candidate must do to attain a satisfactory award in each skill that is assessed. They do this by seeing the patient themselves and agreeing on the important clinical findings and what a candidate should be able to demonstrate in each skill area. Examiners set the level of their assessment at that at which a trainee should perform towards the end of their core medical training. Candidates in PACES are required to demonstrate that they are capable of safely and effectively managing patients in the acute take or general medical outpatient clinic. After each candidate has moved through the 5 stations and 8 encounters of their PACES cycle, a large amount of information has been gathered about their performance on each of the 7 clinical skills. This slide shows how the marks are tabulated for the 7 skills. Note that a total mark for each skill, shown in the separate columns, can be derived from the sum of the separate marks at each encounter. The total marks for each skill are then summed to form a total test score in the range 0 to 172. The PACE standard will initially be based on this total test score, that is, the total number of marks that a candidate attains in the whole cycle. In late 2010, an important further change will be made, and a minimum required standard for each skill will be introduced. Following this, a candidate must attain the minimum standard in all 7 of the skills, rather than just attain a specific overall test score, if they are to pass the examination overall. However, the overall standard of PACES will not change from the current examination. That is, the examination will be no harder or easier to pass than it is at present. However, the new system will ensure that candidates cannot compensate for poor performance in one skill area with better performance in another. Passing candidates will therefore be demonstrably competent across the range of skills assessed. An additional benefit of this new system is that it provides improved feedback for candidates who do not pass. Candidates will be able to see just how they scored on each skill rather than on each case, and can use this information to improve performance on that skill before resitting.